This patient is a 26-year-old female with a bucket handle tear of the medial meniscus, demonstrated on the below MRI, showing the classic double PCL sign. For the meniscus body repair, I like to do inside-out vertical mattress sutures. These are then tied at the end of the case on top of the joint capsule. In this particular case, I use a total of 3 inside-out sutures. For the posterior horn meniscus repair, I like to use all-inside suture repair devices. These are also repaired in a vertical mattress fashion. I like to use a knot pusher to tension the all-inside meniscus repair devices to avoid inadvertently cutting the suture. The sutures are kept and not cut until the end of the case, so I can sequentially tighten all of them at the end. The sutures are now sequentially tightened before cutting to ensure we've achieved maximum reduction. The inside-out sutures are tied on top of the joint capsule, now demonstrating the final repair.